So this is one of the hospitals that have been destroyed in the last 3 weeks. مستشفى نبض الحياة, or the Pulse of Life Hospital. It's near the city of Hass in southern Idlib, south of Ma'arat al-Nu'man. The city has a population of 15,000. The hospital was bombed multiple times inside the city, so the village refused to allow the hospital to be built in. So it was built inside this cave in the mountain for protection and outside of the city. And unfortunately, last week it was destroyed completely and it's out of service. This is a hospital that was supported by an American NGO called Syria for Relief and Development, and has been serving this area for the past few years, and now it's out of service. Of course, this is one of 18 hospitals that were destroyed in the last 4 weeks. 18 hospitals were completely out of service, were destroyed by the Syrian and the Russian regimes and bombings. According to the WHO, 20 attacks happened on hospitals in the last 4 weeks. And these 18 hospitals were serving 180,000 patients every month, including 1,400 deliveries and 2,000 surgeries. So now the population of this area don't have access to healthcare because of the targeting of healthcare hospitals and providers. According to Physicians for Human Rights, more than 890 doctors and nurses were killed in Syria, and also more than 555 attacks happened on hospitals and the medical centers in the last 8 years, mostly by the Syrian regime and by the Russian government. This is unfortunate because it's compromising medical neutrality. According to the international humanitarian law, doctors and nurses should have access to health care. They should be able to treat patients even if they happen to be on the other sides. And we're talking here about civilians, even in the time of war. And what's happening in Syria is undermining medical neutrality, medical impartiality, and make it very difficult for population who are already displaced in this area to receive health care.